So let's start with the layers of the heart wall. So the outermost layer of my heart wall is my epicardium, and that's where all this fat is deposited. Here is the myocardium, that's where your muscles are. The innermost lining would be your endocardium. So you see this line right here, and this line, that is all the endocardium. Alright, so this is the left side of the heart, this is the right side of the heart. The way you can tell is look at the size. Look how much muscle is on the right versus the muscle on the left. It's much thicker on this side. Right, so up here is where the left atrium is. It looks like this because they have the other half. These lines going up and down, those are your pectinate muscles. This smooth ridge is your crista terminalis. This is a valve, and these are your heartstrings. This projection is called the papillary muscle. Now, if you open it up, can you open it up for me? Look at all this texture. See that rough stuff back here? That's trabeculae carneae. So when the heart contracts, the blood will go from the left atrium to the left ventricle and out this way. This is where aorta would be. And there's going to be another valve, your aortic valve, that's going to control blood flow. So this thin wispy thing that I'm poking at, that's a valve. Okay? This is the right side of the heart. This is the left side of the heart. In my atria, I have pectinate muscles. So up here, these are pectinate muscles. This is the crista terminalis, right here. This stuff in the ventricles, that is your trabeculae carneae. In your right atrium, you are going to find a fossa ovalis, this white pit or indentation. There's 3 blood sources going into the right atrium, your superior vena cava, your inferior vena cava, and your coronary sinus. All right. Now, when the atria sends the blood into the left side of the heart, right side of the heart, ventricles, it will then send the blood out through the pulmonary trunk. So that's pulmonary trunk right there. So it goes to your lungs and will come back. It comes back to the left side on your 4 pulmonary veins. So 2 on the right, 2 on the left, and it goes into the left atrium. From the left atrium into the left ventricle and out through the aorta to the rest of the body. Okay, now when it comes to coronary circulation, this little stump, that's the left coronary artery. This is your anterior interventricular artery. Anterior interventricular is paralleled by the great cardiac vein, and this is your circumflex artery. On the right, this is your right coronary artery. This is the marginal, and the marginal artery is paralleled by the small cardiac vein. In the back, if you trace your right coronary, this is your posterior interventricular, and it's going to be paralleled by your middle cardiac vein. So these veins merge with each other and form the coronary sinus. It sends the blood back into the right atrium, and the whole cycle starts over again.